Good afternoon, Patrick.
Hi, Alex. Thanks for having me.
Thank you so much for being on the show and accepting the invitation. I've been so much looking forward for this interview. As I already mentioned in previous exchange on the platform, is that I'm so much interested to have your insights because you have obviously, besides the fact that we both are ambassador of Aging 2.0 of individual city chapters in Switzerland, we share also a very important element that is actually the whole ecosystem about informal caregivers. And I have the luxury of knowing you because you have been dealing with this for quite a while. You can tell us a little bit more as by way of introduction, and then we can perhaps dive into the subject.
Sure.
So I would say the floor is yours, Patrick.
Yeah, congratulations, Alex, to the channel. It's great that we have a best practice sharing platform for innovators in the senior living space now.
Thank you so much.
Innovative video format. Yeah, very excited to be here. Yeah, let me introduce myself, Patrick Hofer. I'm co-founded Pro Aidants back in 2018. That's a non-profit advocacy organization for informal carers in Switzerland. Beside that, I'm also a tech entrepreneur with We Plus Care coordination solution. And as you mentioned, we both are involved in the Aging 2.0 network.
Yeah. And how long have you been busy now with your with Pro Aidants setup organization? How long has this been running now?
Yeah, I think it was early 2018 we started. The thoughts were around, but then I think it was in April when we had a kickoff.
Congratulations. We'll talk about that more in a minute. In order to kick off the conversation, could you give it an overall profile of who are those informal caregivers? I mean, what are the overall, what do they represent in the ecosystem so that we can then afterwards a little bit dive into in more depth about it?
Yeah, sure. Yeah, what is an informal caregiver? Most people don't realize that they are a carer. It starts by doing the bills for someone or the taxes, and in a later journey you have a lot of time to care, social care or even medical care or nursing, provide nursing. In Switzerland, we have, according to recent studies, 600,000 considered informal carers. Proches aidants, on dit, or betreuende Angehörige. And every 1 of 13 is a carer.
That's huge.
2/3 have a job as well, doing it beside. And the lion's share is done by women of that unpaid care work.
Yeah. And what is their perspective on their personal situation? Any thoughts on that?
Yeah, it's extremely individual. Yeah, we have different, let's say, groups or segments. This can be older adults that look for their partners, or in high old age, like they're around 80 or 90 years old, that look for their partners that has needs help. This could be kids. We have around 40,000 kids or young carers, how you call it, that besides school look after their parents. Some have psychological problems, and they care and sacrifice their spare time for caring in that age. And then we have a huge group of sons, daughters that look for their parents that getting older. And so there we have, the distance carer, you can call them, living away, not living in the same household. Or we have also the saying sandwich carers. that are those that, like myself was, where you have a job, you also have a family and kids or small kids, and you need to care for someone of high age. So you are in the sandwich between the generations.
Yeah. As we both know, obviously, with the demographic shift, we all know, and our health system that are under pressure, and also the economic pressure that comes along with COVID, but even before, it's everywhere is sort of like a fact that we know that the pressure is going to go up towards these informal care. Is there any really hot or the most important unmet needs that you've identified already with regard to them?
There are many, you can say, and many open questions and problems, unmet needs. I think COVID, as you said, totally made it visible. So we had this year was the end of a huge research program from the Federal Office of Public Health on informal caregiving, and so it created huge insights on what care needs, and just to give you some points, like the acknowledgement of carers is certainly an issue, or the appreciation what they do, appreciation / compensation. Should they get paid or not? These are issues. And we have, like, when we go in the health system, like we look it more from a medical health system point of view. There we have the demographic shift, people getting older because of health innovation and better lifestyle. And so people have more diseases or more health problems parallel. The care gets really complicated. And as we have here an extremely good social and healthcare system, but it's also fragmented. Many different players, and to align those different involved parties and have them in that care journey integrated, that can be a challenge. So the program found out that most of the carers do not find suitable offers when they need it.
Okay, and reimbursed and not reimbursed, I can imagine, or subsidized, or with or without any support from government or health insurance, I would imagine.
Yeah, well, that's another jungle. Care needs to find out who pays what, where can I claim what. That is different in any municipality in Switzerland.
Municipality,
yes. Okay. And so this is, I refer it to Asterix and Obelix finding that permit A38 in the Roman bureaucracy. I would say the system is pretty complex for carers to navigate. For example, 20% of the claims are not, of the allowances are not claimed. That would be available, and often from those in need with cognitive problems or migration background, and those that especially would need it, and these are these are problems, challenges we need to solve to make it easier to care for someone.
So also informing them on what type of levels of support do exist is already there before even the rest of the needs is already there, flagged as a problem, as you mentioned. If 20% of the people don't claim, or 20% of the cases are not get claimed afterwards. Yeah. Okay.
Yeah, absolutely. I mean, it's all here. Of course, there might be some new elements we need to introduce, but I would say we have a good situation here in Switzerland where it's all here, but the challenge is really getting it and find the right service or angle to find solutions.
Okay, so this is a bit where the as is situation is, but how do you see then the future, and what will it bring for them? If you look at all, as well as from the demand side, as well as what's been being in the process of being developed, where you see their situation evolving?
Yeah, I mean, the challenge is a little bit bigger than expected. There are more informal carers that was sometimes a bit surprising. Yeah, and we have also we have the trend of the demographic development. So more people need help, and we have a social development, a social change. People don't live at their place anymore. The mobility is higher, live in another city or the country. Less kids, or no kids. And also, women that used to care normally, traditionally, are more engaged in the workforce. And so we have a slight tendency, I would say, that the willingness to care is decreasing with an increasing demand. And so who will fill up the gap? Does it go to professional care? Do we see a professionalism of social care or caregiving? Who will do it? We already have 2 little nurses. And so, that's the question.
And I think also the social element, I think COVID also made a little bit clear that people that are in isolation, that there are even, the nurse as much towards the health side and towards health support side, the demand is high. But I think also from a social perspective, that is is quite of a challenge, I can imagine.
Yeah, we saw the solidarity in the COVID crisis initially. Everyone wanted to help, put posters on the walls, a huge organizement. I was really proud to see how especially young people organized. But then I also read another study that soon after, no one cared anymore. And so, I mean, how can we motivate people to care? Also volunteers that step in. I think these are the societal questions we should ask ourselves.
Are there any today an evolution in types of initiatives today, and what would they be in order to alleviate the pressure on them? Can you elaborate a bit on that?
Yeah, there's sure a movement into policy development. We just had the bill passed of better aligning care and work. So people, excuse me, like parents with sick kids get more holidays from their employers. This will be introduced next year with other slightly benefits. Compared to other European countries, we are nowhere. In Italy, you get 2 years paid from the employer to care for someone. In Germany, we have the care insurance, where you get paid when you do care. But I see movement here in Switzerland. We have several initiatives on the political level that are looking at social care for everyone. Is it a service public? Yeah?
Yes, indeed.
Yeah.
And you get actually into the whole debate that we recently voted on, even with childcare, same debate. Should the government intervene, yes or no? Or is this like a private matter? You have this whole different opinions. I think it's also related to that as well.
Yeah, that's a good example. I mean, the childcare laws did not pass. Yeah,
did not pass, indeed.
Yeah, exactly. And then that means women need to look after their children. But do we want to have women in the workforce or care? Yeah. I mean, it's a conflict of political targets. We need to decide. Sooner or later.
Sooner, indeed, It's a big channel. So no, and I think is this also a little bit where the initiative of Pro Aidants wants to contribute, and perhaps you could explain a little bit in a few words where Pro Aidants is different from already the existing ones, and perhaps which ones are those existing ones, and where Pro Aidants is different. Could you elaborate on that?
Yeah, Pro Aidants is a non-profit advocacy organization.
Yeah,
and we, as one part of the purpose, our mission is to create better frameworks, also on a policy level. There is another advocacy organization, la Communauté d'entraide proche aidants. We are also member there. This is a group of service provider for carers, and that organization is influencing the advocacy on a national level.
Okay.
Yeah.
In terms of
but
policy,
we found that
on policy.
And we found out that sometimes the interests of organization are not the same as the interest of carers, and so that was the foundation of Pro Aidants, that we have an organization that is really carer-led, like focus on the carer's perspective and ask them directly what they need and bring that to unfiltered, more or less, to the decision makers. Yeah.
Okay. That's right, and that's a bit where the core difference is in the value proposition of Pro Aidants. Is that?
Yeah, sure, we can say, but I mean the biggest differentiator is that we are providing a solution. We are not only asking for politics to solve problems, but we also provide a solution in the field of care coordination. So Pro Aidants has an income strategy in a social business approach or social innovation venture.
Yeah,
we want to solve the problem of care coordination. That's our daily job to do.
And would also be that you're starting off from the informal care as a first, and not the formal care. Your starting point is the family and direct the people involved privately with the person that you're serving or that you're caring for, than the professional one. So there is one, should I say, step before, I would imagine, to alleviate the informal care, correct?
Yeah.
That's not very...
Absolutely, yeah. We focus really our initiatives, our solution around the needs of the carer.
Yeah.
And if you want, the carer, don't forget, is also a player in the health system, and we are the biggest player. from the numbers. And so this is often got forgotten, because without informal carers, the system would collapse, because informal care has a coordinating function,
Correct.
like a management function, where he's not getting paid for. And without that job, many formal care operations would not work as smooth as they run now.
And
And
it's actually,
they need an instrument to do that job. I mean,
And
you can pay your train ticket with an app, or buy it. Why not giving informal care as a tool at the hand?
no, indeed. And I can imagine that by design, from a starting point, they're less professionally organized, as they are not a professional organization. They're doing it informally. They are therefore, doing as a side, private-oriented job. I found, and therefore there needs some really professional support helping them to do what they do. Okay, no,
only because you do it unpaid, it doesn't mean that it's not professional.
Indeed.
And that sometimes got forgotten in the analysis, if you follow the numbers.
And that actually brings me to the next question, is that how do you see innovation and technology now actually coming to the rescue, if I say, to the informal care? What's your perception on that?
Yeah, of course, I have a digital background, and that's why I stepped into that field. If you see allocation of resources, or allocation of care resources, if we look at that, their technology can make a huge difference. So we saw it in other industries, and I think the technology is a key driver to solve the problem of care coordination.
I see. And isn't it also that you are really much more coming from the health prevention side than I say reimbursement, or in health there is always a big challenge. Where should we put money in? Is to cure sickness, or to prevent people from becoming sick?
You can add another layer there.
Okay, please go ahead.
These are the classical digital innovation fields we see, like customer experience, prevention, or curation.
Serving somebody instead of curing him.
And if you look at our clients, or our needs of informal cares, we often operate here at high age, often at the end of life. And here we cannot prevent anything anymore. We cannot cure, but we only can reduce the burden. It's also a little bit preventive, to prevent emergency entries and stuff. But the main goal is really to stabilize the situation. We cannot cure. Prevention has been done all the 90 years before. So, but we at the end of life, we just need to lower the burden, the pain, and the pressure, and the administrative task, which can be automated with digital.
And I can imagine that also accompanied with that, new operating models, service models, even new roles could be deployed, invented there, that are perhaps not immediately health related, reimbursed related, to accompany those informal caregivers. Any thoughts on that?
If you look at how much time is spent for caring, let's say, for an older adult as a big group, there we have 80% of the time is for informal social care that has nothing to do with health or medical. And only 20% is provided by the long-term care provider. So from that perspective, yes, there is a big opportunity to provide services for the informal carers to make their life easier. Yeah, and don't forget the other 600,000 older adults that have no carers, no sons, daughters, or their people passed away. Who is helping them?
Yeah. Who is actually? What's happening with them today in Switzerland or even other countries? And any ideas on that? How are they being supported now?
Yeah, that would be a good session for another talk here. And I think senior housing plays a role there too.
Because obviously, if you group people and obviously you can share I'm not going to say the burden, but some kind of needs and regroup them, and also people amongst themselves can help each other as well, and also can play a major role in social interactions among themselves. I think that is perhaps something that could alleviate also the informal caregivers. That is any particular thoughts on that with regard to housing?
Yeah, I mean the design of spaces or quarters in a community plays a huge role. How community interacts, help each other. Yeah, we're seeing here a big effort in the City of Zurich strategy also, where like let's say advisors are put into the living areas, that social workers that interact with the inhabitant, with the tenants, and try to create communities or help them solve problems. Interact as an interface to the family or even providers in the area.
No, would it actually be blunt to say that focusing mainly on the informal carer, his ecosystem and his needs, serving the people who are actually in need, is actually one of the greatest challenges in order to respond to the future demographic shift? How would you comment if I would made a remark like that? What would be your comment? Agree or don't agree?
Yeah, I agree. I mean, the informal care is a societal challenge we need to solve in an aging society.
Yeah.
We need to discuss it. We need to find solutions. We need also to debate it on a societal level.
Yeah. So, but inside there is many things to talk about, I can imagine, which obviously we won't be able to cover in one expert interview, Patrick. So if you allow, I would love to dig into different elements, obviously, that are touching this informal caregiver, and perhaps we can zoom in on that, on those specific elements in future interviews.
Happy to come back.
Excellent. Thank you so much, Patrick, for already giving a clear testimony for the informal caregivers, and I look forward to welcoming you in the future on the platform.
Thanks for having me. Looking forward to see you soon. Tschüss.
Likewise, Patrick. Thank you. Bye-bye.